in this room on Medicare. They're not doing it to protect Medicare. They're doing it to create a new entitlement. They're taking money out of Medicare to create a new entitlement for people who are not Medicare eligible, or under 65. That's what's happened here. That is the reality. And the sustainability of this, I think, is, and what's already happened in Washington, and this is one thing I must be perfectly candid. In Washington, they're not going to pass, you're going to see attempts over the next 10 years. You're going to see folks who voted for this law and groups that supported this law working round the clock to repeal the provisions they don't like. It's already started. It's already begun, and it's going to get louder. I mean, I'll give you one example. The 1099 provision. Most of you may not be familiar with that. Some of you may be. If you're in small business or you're an accountant, you know what it is. But there's a provision in there that if you do business with vendors and you pay them more than $600, you have to issue them a 1099 form. That means you have to get their social security numbers. Well, this is a paperwork nightmare for small business. I had one guy in Allentown who's got a scrapyard call me up and say, geez, Congressman, he says, I have a few hundred people come to my scrapyard every day with their personal property, and I pay them for that. And I pay them more than $600 in many cases. I have to get social security numbers from them now? I said, what are you doing to me? Well, apparently this has created a problem all over the country. People are furious and apoplectic because now, if that provision stands, many businesses are going to try to consolidate those with whom they do business to avoid this paperwork nightmare. That's just one provision. So there are already attempts to repeal it. And it should be repealed because it's a bad policy. You know, this health care law taxes you if you have health care benefits. And it taxes you if you don't have health care benefits, the individual mandate. But the tax on the benefits, for example, that takes effect on the Cadillac plans. That takes effect in the year 2018, 2 years after President Obama's second term, should he be reelected, okay? But many of the unions, for example, very much objected to that provision, the tax on the Cadillac benefits. They supported the bill. But they'll be working round the clock to get rid of that provision between now and 2018. The medical device tax, which has a real negative impact in this community because of the number of devices with places like OraSure, and Olympus, and Vibron, and Boaz Surgical, and all these places making devices. There'll be people working around the clock to mitigate that. The point is that as we are trying to, you're going to see people, there are going to be attempts to basically get rid of the pay-fors, anything that pays for this. Oh, the Medicare cuts, right? Many of the hospitals supported the bill, but they don't like the Medicare cuts. And I certainly don't, the seniors don't like them either. So what's going to happen is people are going to be working to water down anything that pays for this stuff, whether it's on the tax side or the benefit cut side. And then what will happen is that all the new entitlement benefits will remain. But the pay-fors will go away or be watered down, and the deficits will skyrocket. That's what's happening in Washington. You're hearing it already. I mean, the 1099 issue is a very big deal. And that's just the first of many that you're going to hear more about. Or the retirees from large companies who have prescription drug benefits. Well, the law essentially is going to cost all those companies that provide those benefits, you know, billions of dollars. It's a huge amount of money. And so the incentive there is to cancel those retiree prescription drug benefits. I mean, you've read the articles about Verizon and AT&T and Boeing and all these companies and John Deere that have these benefits, and they're saying they have to charge a big loss now on their benefits because of one provision they changed with respect to the Medicare Part D law. Big problem. I mean, so these have to get fixed. And sadly, this isn't going to get fixed between now and the election. Because it would acknowledge the people who voted for this would have to turn around and acknowledge their errors before the election. And they're not going to do that. So that's what we're up against on this law. I mean, this is a massive issue. You get into the notion of rationing. And I've said all along that the Massachusetts law on health care is a precursor of what will happen with the federal law. Because what will happen up in Massachusetts, they have individual mandates, they have employer mandates. They've essentially created an entitlement. And now that the fact that the costs of their program have gone up, there's no cost control built into the law. You know, certainly universal coverage is a noble goal, but universal coverage without cost control will lead to what they have up there, which is massive deficits. Costs go up, the ability of the taxpayer to meet the rising costs is limited, so what do? They cut back services, they curtail, they deny. and people will have their coverages disrupted.